think I was muted. Hey, Dr. Mac, how's it going?
All right, how are you?
I'm good today. How are you doing?
Doing okay. Doing okay.
Good, good. I know you have a lot going on and so much going on in the world of COVID and among other things, and how, COVID is impacting other things. And so, we got a great show lined up today, and we just want to thank everyone for joining us once again for the Network Live. I'm April Garner, the network founder, and of course, Dr. Winston D. McIver Jr., our trusted physician of Waccamaw Primary Care in Conway, South Carolina. He is going to give us our weekly COVID-19 updates. And then we're also going to touch on a little bit about your concerns regarding the vaccine. The rollout was this week, and of course, locally here in Horry County, we felt the effects of the rollout in terms of people's perceptions and their thoughts and feelings about receiving the vaccine, now or in the future. And so, Dr. McIver is going to give us his pretty much his spin on that. And of course, he's going to come from a medical standpoint. But before we get into all of that, we're going to definitely get into our COVID-19 updates. I just want to remind everyone, if you have any questions or, concerns that you want to post to the thread, please do that. And we will certainly get to your comments, questions, and even suggestions. I posted some information in the network, I think a few days ago, asking people what their thoughts and their fears were. And I know Dr. Mack probably didn't even have a chance to see all of that. But, I will definitely go back to that thread to see if I can, pull some information that may help us as we create this conversation today. So, Dr. Mack, before we get into all of that, though, again, thank you so much for everything that you do in the community. It's a pleasure to work with you every single week. And I tell you, your energy is tireless. Your spirit is tireless. And what you're doing, you're organically giving from your heart and from your soul, because you really want people to be safe and to be educated about how to be safe. And, I see it growing in you every single day, even the frustration sometimes when people don't seem to pay attention or listen to what it is that we're saying. But just know that I'm sure you are reaching, even if it's just one person, you're doing your job. And so this is, quite an honor to be with you every single week to do this type of thing. So, Dr. Matt, where would you like to start?
First, I'd like to start by saying thank you. And I certainly enjoyed doing this with you also. Just as much as you have faith and trust in me, I have the same in you. So thank you. And I appreciate it.
Not a problem. Not a problem. So we want to definitely encourage everyone to share this video or share this live stream on your pages. Start watch parties. Do whatever you have to do to make sure that people are viewing this information today. Of course, it is always available after the broadcast, but if they can be a part of the live discussion and engage in what we're saying today, that's even better. I want to send some shout outs to some folks who are in the thread today. Of course, we can't get started without saying hello to the Emmanuel Nye Memorial Foundation for being a destination for this particular broadcast. Thank you so much for allowing us to connect with you every single Friday. And of course, Dr. McIver is a homeboy of sorts, so that's even better. You're getting it from a trusted source. So thank you so much to the Emmanuel Nye Memorial Foundation. And just want to remind everyone that they have an ongoing campaign of giving for the Memorial Foundation. And if you will visit their Facebook page, you can find out more about their 17 on the 17th campaign that they have going to raise funds for certain projects and initiatives that will support the Emmanuel Nye Memorial Foundation. So please support them as well. Hello, Rosa Vereen, Michelle Nicole Kelly, Timothy McCrae, Tara Hill Starks, Laquanette Brumel. Thank you so much. You guys are tuning in today. We really do appreciate it. And we definitely love to acknowledge our viewers and those who support on a weekly basis. So, Dr. Mack, do you want to start with some numbers, or where do you want to go with this?
We'll start with the graphs first.
All right. So let me, I'm going to add that here. And then if you'll hold on for just a second, I'll make sure everyone can see it really good. All right.
Okay. So basically this graph is kind of looking at the United States. And I really like this graph because it kind of breaks down what we're dealing with in the medical community, physicians, public health folks. this graph kind of gives an information. We'll do the same thing for South Carolina in a little bit. But right now, there's over 17 million cases, positive confirmed cases of COVID in the United States. On December the 23rd, there was actually almost 240,000 cases, and as of today, that's new infections. As of today, the latest data that just came out is there's a national record where more than 245,000 people were diagnosed today alone. In the past 14 days, the number of cases have gone up 18%. 18%. The number of deaths, we're over 300,000 deaths now, right at almost 311,000 deaths. Yesterday, there was over 3,200 deaths, which is up almost 40% in the United States. And hospitalized, right now, there's over 114,000 people hospitalized in the United States with the diagnosis of COVID, and that's up 10% in the last 14 days. Now, I want to go back to that middle column just for a second, with the deaths. Wednesday, we had the highest recorded number of deaths in a single day from COVID. That was over 3,600 deaths in one day. Now, let me put that in perspective. That's more people than died in Pearl Harbor. That's more people that died in 9/11. And that would be the equivalent of about 18 737s crashing on Wednesday. So that's the numbers, that's the perspective. About 18 737 aircrafts crashing on Wednesday and everybody dying. That's the kind of, on a single day, that's the number that we're seeing. We're now having numbers where there's over 3,000 deaths a day. And that's kind of becoming a commonplace, with the thought that those numbers will go up and we probably will hit 4,000, maybe even 5,000 deaths a day. As we look at this graph, and still talking about the United States, we see that this tail on the right side is peaking tremendously. Now, that little blip going down, I'm not quite sure what that means there, but nonetheless, that tail is going up and it's continuing to go up. What we're seeing right now is pretty much the after effects of Thanksgiving. Okay, as it's held true, pretty much after every holiday, Memorial Day, Labor Day, 4th of July, Thanksgiving, these numbers have gone up. And so we're seeing this now. Unfortunately, it's no surprise to me that we're seeing this, but the rate of rise, this curve going up, I mean, this thing is almost going straight up. We're having spots where it's going straight up. And so that's a concern. That's a major, major concern. This has been a troublesome week, to say the least. To say the least. Next slide. Next slide focuses really on South Carolina. And basically what we're seeing here is that is a horrible curve on the left. I mean, on the right, the far right. That curve is going straight up. And so what we're looking at, the number of cases totally in South Carolina have been over 260,000. On yesterday, there was over 2,600 cases. In the last 2 weeks, the number of cases have gone up 73%. 73%. The number of deaths in South Carolina right now, we're over 4,800. On yesterday, it was 43 deaths. The number of deaths in the last 2 weeks have gone up 45%. Hospitalized, over 1,500. That number has gone up 33% over the last 2 weeks. So again, these numbers, they are what they are. And again, this is valid statistics, it's valid numbers. These aren't made up numbers. These numbers have been verified. They've been given to the entities that look at these, they're actuarials that look at these numbers as far as biostatistics and epidemiology. And this is what we're dealing with. And the concern is that this is likely going to get worse. Next slide. Next slide deals with South Carolina and the rate of cases per 100,000 individuals. If you all have been following us, you know that I explained it to you that when we look at cases and deaths in biostatistics, we normally talk about per 100,000 people. That way we can compare South Carolina to New York State, to Georgia. You can kind of make a comparator in that way when you standardize it by 100,000 people. So South Carolina's total average rate of cases, positive cases per 100,000 since we've been looking at COVID has been about 18 per 100,000. In other words, for every 100,000 people we have in South Carolina, 18 of them have been positive. That's kind of overall. The last 30 days, in the last month, it's been almost 44 per 100,000. Yesterday, it was 73 per 100,000. That's staggering. That's staggering for a pandemic. It's staggering for something we've been talking about for a long time. So again, yesterday was 73 per 100,000. Unbelievable. One of the worst in the country. So this is what we're dealing with in South Carolina. This is what we're dealing with. This is the rate of cases per 100,000. Okay, so that tells you how much this is going up. Next slide. Next slide talks about percent positive. So I think part of that slide was cut off. So on the percent positive, again, we were saying percent positive, less than 5% is ideal. Less than 5% is good. Less than 2% is ideal. So totally South Carolina, since we've been looking at COVID in South Carolina, has been almost 15%. Over the last month, it was a little over 18% positive. The previous day, and that number's
that previous day, Dr. Mack, is 25.9%.
Right. So right at 26% positive. So that's basically saying what, 1 in 4, over 1 in 4 people that are being tested are now testing positive. Those are worrisome numbers, particularly when we're talking about 14.8% overall, but yesterday 26%. That just gives you an idea of what's happening as far as the numbers go and how important and significant this is. Next slide. Next slide looks at the counties. So in Horry County, there have been, as far as the deaths go, it looks like 243 and 47 probable. As far as the total cases go, right at 16,000 with almost another 2,000 probable. So that just kind of gives you the information on Horry County and letting you know where we are. And those numbers are going up. The next slide is Georgetown County. There have 49 confirmed deaths with 21 probable deaths related to COVID. And as far as the positive cases, 2,600 confirmed and 761 probable. So that just gives you an idea, and those numbers are going up. And the last one is Marion County. We have 48 confirmed deaths. No.
There you go.
Okay. Yeah.
Hold on just a sec. I'm too fast for my slides. All right, there you go.
Okay, so we'll go to the 2 slides. Right, to Marion. So Marion. Yeah, we'll go back to Marion.
All right.
Okay, so Marion, 48 confirmed deaths with another 4 probable related to COVID. As far as the total positives, over 1,500 with almost 100 probable. Now, again, with the understanding that the percent positivity rate is high, which means more testing needs to be done, which means that these numbers are probably higher. They're actually going to be higher than what we're actually seeing right now. But this kind of gives you an idea statistically of what is there right now, just so we'll have an idea of that. Okay. Next slide. Okay, so on this one, as I said earlier, And I just said that in another slide. The percent positivity yesterday was 26. Actually, that's today. Actually, I just put it up 26%. Right. So again, the numbers are up. The numbers are high. They're real. South Carolina is actually on the list of worrisome trajectory. As a matter of fact, there are 3 states in the South that have been identified as having a worsening trajectory in the numbers going up. Georgia, Arkansas, and South Carolina all have set weekly case records. So Tennessee is actually identifying the highest cases per capita in the country. So Tennessee is actually getting hammered right now, as are the other 3 states in the South that I named. This has been a discouraging week, to say the least. And you know, I think as people understand the significance, yes, we're in the red. So understand the significance of this is that we're headed into a holiday time. We're headed into a time where folks are going to I mean, unfortunately, people are still going to get together. And my recommendation is that you not do it. My recommendation is, if you can't account for where people are for 14 days prior to y'all getting together, you probably don't need to meet with them. What I tried to do earlier, right after Thanksgiving, was had a community test. I've got another one. The next slide. I've got another one set up again in Conway on this coming Monday from 8 to 2. Please come out. I want to have one done right after Thanksgiving, and I want to have one done right before Christmas. Please come out. The preparation will be there for whoever comes. It's drive-through. You don't have to get out of your car. It's a seamless process. It's gone well. Results have been back within 48, 72 hours. And it is very important to get tested, especially going into the holidays. Because again, if you don't know your status, you can affect a lot of people. And I've had a number of patients that have been positive here lately. And a lot of it has been from family gatherings that happen over Thanksgiving. So again, please be careful. Please understand that this is real. Understand that the life you save may be your own. Okay. Okay.
So, listening to the news and hearing all the reports about the numbers and, what's happening with the cases, obviously we know that there's going to be some trending upward because of all the holiday gatherings and things that you've mentioned. I think that sometimes people are a little misguided by things such as misinformation about how long it would take for symptoms to show up. And it's been a while since we've revisited that. So obviously Thanksgiving was what, some 4 weeks ago, 3 or 4 weeks ago, something like that.
Yeah, probably about 3 weeks ago.
Yeah, about 3 weeks ago. So how soon would people start to exhibit symptoms if they were indeed infected Thanksgiving? Would they start seeing that now? Does it vary? Let's remind people of that.
Yeah, typically if you're going to have symptoms, you're talking about anywhere between 3 to 12 days usually. Okay. Now, but again, this is almost like branches on a tree. So one person may get affected during that time, and they may not affect somebody else until 4 or 5 days later. So that's why you can't really put a real time frame on it. We just know when we start to see the trends going up. But as people, if I'm infected and I'm walking around, I may have symptoms, I may not have any symptoms, I may have a few symptoms that I think is just a cold. I'm still going out around and about, and I come in contact with April 5, 6 days after I've had it, then I can pass it to you. And then you can take it, and then 5 or 6 days later, you can pass it to somebody else. So again, it's not like everybody's going to have that within, 10 to 14 days, because it's exponential. But it starts here and it goes up just like that. And that's
Mm-hmm.
where contact tracing comes in. That's why having these tests done where the results come back soon is important. Now, I want to say this with the test that the company that we use, everybody's given a paper on how to get their results. I had about 4 or 5 people call me and say, I hadn't gotten my results. And I said, well, you hadn't done what you were supposed to do. Because the paper tells you exactly how to access your results. And I know for a fact they were back within actually 36 hours. So if you're telling me 3 weeks later you don't have your results, it's because you didn't do what you're supposed to do to access it. So, again, that testing date was successful, but I want to try to get as many people out as possible. So please pass the word, because when I was called about what can be done to help me, I said, it's let's get it in the community. Let's get it in the community. That's what we need. That's what we need.
And I think
there's going to be a significant number of people that just haven't made up their mind about the vaccine. But you may have a lot of people that'll say, well, I'll go and get tested. If you've never gotten tested, you need to get tested. Okay? I can't emphasize that enough. Unless you're in your house and you're not seeing anybody for weeks and weeks and weeks, you need to get tested. You need to know. Okay? You need to know. It's just that plain and simple. The tests aren't nearly as bad as they were in times past. I've gotten 13 tests in the last 15 weeks. And so again, we need to know, you need to know, so that way you can protect yourself, your community, and your household.
Well, Dr. Mack, you mentioned vaccine, of course, and that's one of the things that I know people have top of mind right now because of everything that's going on with the release of the vaccines. I read in an article, I believe yesterday or day before, is it true that the FDA has approved the vaccine? Is that true that you know of?
The second vaccine, you mean?
Yes.
The recommendation is for approval.
It's for approval. Okay. All right.
So within the next week or two, there will be a second vaccine out.
Will be a second vaccine. Okay. So and of course, regarding the one that just rolled out, especially here in Horry County, you and I were talking earlier about some of the perceptions surrounding the vaccine and what people I guess are gathering as far as information and how this is all feeding into the anxieties and the mistrust and everything that's going on with the vaccine. And I know from a medical standpoint, you have a particular stance that just kind of goes along with the ethics of what you do. But when it comes down to the public's feelings and perceptions, their fears about the vaccines, what can you say at this point, or what would you say at this point that would help to ease people's minds about even considering it as an option, instead of just flat out saying, no, it's not me, I'll pass, or whatever the case is? Because even I've said that, but at the same time, I'm someone who is in high risk categories that almost would require that I take the vaccine. So, what are some things that you could say to us right now, just to filter through all of this information about the vaccines and whether or not we should even, be in line to get it?
Well, let me start off by saying it this way. I understand the distrust, first of all. Medical history is something that I studied, that I take an interest in, and I certainly understand it. But again, right at this point, we've got a pandemic that's happening. And, again, if you've got multiple, and vaccines are an individual decision, okay? So patients come in, I talk to them about the pneumonia vaccine, the shingles shot, the flu shot. We talk about all those things, tetanus, we talk about all those things. And again, as a physician, my job is to look at the person, their medical conditions, their risk factors and talk about ways of reducing disease and death. Okay. So with that being said, the vaccine right now is going to be the closest thing to stopping this spread, because enough people aren't wearing masks like they need to.
Mm-hmm.
There's going to be some issues with the vaccine, though. Number one, we're going to need at least 70% of people to take this vaccine to make a dent.
Mm.
Okay, so that's one thing. Right now, the Pew Research, which is a big research company, is saying that right now, 45% of people of color are distrustful and do not plan to take the vaccine. Now, my concern about how this vaccine is being pushed is that I don't think that they're doing a service by showing the first person who got the vaccine is African American. The first person who administered the vaccine is African American. The person one of the people who helped develop it is an African American. People are going to take the vaccine when and if they feel like that vaccine's for them. As a physician, though, I have to trust the science on this. And the reason why I have to is because we're on a pace for 400,000 people to die by February. And you're still going to have a percentage of people that are not going to wear masks and things. So again, you want to try to protect yourself as much as possible. Now, if you choose not to take the vaccine, you definitely need to make sure that you're doing all the things that you need to do. Because again, people are dying, and South Carolina, the rates are rising. As I showed you already, the percent positivity, the cases per 100,000, the fact that South Carolina is one of 4 southern states where the trajectory is expected to continue to go up astronomically. So we live in a hotspot. Mm-hmm. Specifically, Horry County has been deemed a hotspot. And so that's on a national level. And so again, we still got people coming to the beach. We still got all kind of events going on the beach. Mm-hmm. That's going to bring more people to the area, and people are going to get sick.
I know that we talked about the fact that right now there's very little information or data on the long-term effects of the vaccine, and I think that that's what people are also concerned about. Is, if I take it now, maybe I won't experience any side effects, but what happens years from now. And I think that kind of pushes your point about the fact that there needs to be a larger test pool, so to say, or population who have taken the vaccine, so that type of thing could be studied. But you also mentioned that in order to prepare this particular vaccine, there was a very limited number of people who were involved in the initial vaccine testing pool. So, as people kind of filter through the information, is there something that they can do to just make sure that they're kind of, not getting information overload to the point of building up these anxieties when, the bottom line is the vaccine now exists. Yes, there is one that is about to be it's up for approval by the FDA, but there's still a lot of unknowns. Yet it's like you have to weigh the options and figure out what works best for you. I also know that people have anxieties surrounding the requirement or the perception that there will be a mandate on taking the vaccine, meaning the Horry County Democratic Party, for example, recently rolled out information that the vaccines would be distributed in phases. And of course, the first phase would involve medical personnel, and the subsequent phases would involve people who pretty much work in like public service sectors, and then eventually everyone. But, we also talked about the fact that, there's probably some anxieties built up around the word requirement and what people can kind of do to manage that. So, would you say that the best source for even understanding what people should do is just to have those talks with their physicians and kind of, just to kind of stay away from all of the content that is going to flow through in the
Yeah,
next few weeks. I mean,
yeah,
what, because I'm one of those persons who has that, those fears or those anxieties, but I also know that there's some things that I have to strongly consider when it comes down to what I may be asked to do and what I may have to do for the sake of my health.
right.
So, yeah.
So what happens is, I don't know of any entities right now that are mandating that you get it done. Even the hospitals right now that are giving it, it's still on a voluntary basis. They're strongly suggesting it. It's going to be hard to mandate that somebody gets the vaccine unless
Mm-hmm.
it's a private entity like you and I talked about earlier. If it's
Mm-hmm.
a private entity, then you can say whatever you want to. I mean, because
Mm-hmm.
it's your business. But if it's a state business, it'll be hard to kind of mandate for that to definitely be done or else. Strong suggestions, but requirements, I'm not quite sure that that's gonna fly. It is being rolled out in phases, like you said. The plan is for December to have 20 million people vaccinated. In the United States, 20 million. January, 30 million in the United States. In February, 50 million in the United States. So
Will they
by
hit? Will they hit that 70? Will they hit that 70% mark that you were talking about?
no,
Not quite. No, not at all.
no. But again, the first thought with anything really, like let's say something like this, something new, particularly with so much question about it, is just getting the momentum for people to get it.
Mm-hmm.
And so I
Mm-hmm.
think that's where that's coming from. I think the 20 million, 30 million, 50 million has to do with supply and demand also. So as the demand is there, the supply builds up. But again, the thought is to try to get as many people vaccinated. That's the thought by the FDA. We'll try to get as many people vaccinated as possible.
Mm-hmm.
Again, you're right. You need to talk to your physician about it. It needs to be a situation where you talk about it. And if you've got fears, and understandably, again, we talked about, rational fear versus healthy fear. Last week or the week before, irrational fear versus healthy fear,
Mm-hmm.
last week or the week before. Talking to your physician, because they're going to know your health history better than anybody. They would be able to sit down and talk to you and tell you, if you don't get it, this is likely to happen with this condition, because your physician is going to know whether your diabetes is well controlled, whether your blood
Mm-hmm.
pressure is well controlled, whether or not your asthma is controlled, your COPD is controlled. All those things play a factor in this. And again, it's an individual thing. As a physician, as a provider, knowing what I know, seeing what I see, I have to encourage taking the vaccine.
Mm-hmm.
Do I have some questions? Yes, as a lot of people do, because that's the reason why vaccines typically take 5 years or so to come to development, is because the more time you study it, the more you'll know about it.
Mm. Okay. There's a question on the thread from Tara Hill Starks. How would the general public be alerted when it's time to get the vaccine? I haven't seen anything about a communication plan, but
You,
again,
you
uh,
won't because they,
okay.
they don't know yet.
Mm-hmm.
As physicians, our belief is that the entities that will give it out, i.e., the hospitals, health departments, pharmaceutical drugstores, will put it out there.
Mm-hmm.
So there've already been pharmacies that have applied to Pfizer and applied to Moderna to be distributors.
Mm-hmm.
But again, that part has to be worked out. So in essence, the news media is probably going to know this before anybody as to
Right.
Walgreens or CVS
Mm-hmm.
or whatever is now
Well,
getting.
I received an alert from CBS yesterday about it.
Oh yeah.
Mm-hmm.
They've applied for authorization to give the vaccines. Now, again, the question is how to roll it out. Again, there are certain people that are in phase 1A, and that kind of thing, who they're looking at trying to vaccinate first. And so that's why you don't hear much about this, but that's the most likely thing that's going to happen. It's
Mm-hmm.
actually going to be through entities like pharmacies.
Right. And speaking of which, the information that was shared on the Horry County Democratic Party page, and I'm only referencing them because that's where I saw the list at first, but evidently it was broadcasted by WMBF News. Phase 1, for example, or phase 1A, as Dr. Mack just mentioned, would be your medical personnel, your physicians, physicians assistants, nurses aides, anyone that falls, under that, in that particular category, it comes under that category, even medical and nursing students, nursing home and long-term care facility residents and staff.
Well, part of that is because it's people that are in frontline situations.
Exactly. Mm-hmm.
But also, South Carolina leads the nation in nursing home deaths related to COVID.
Mm-hmm.
So
Mm-hmm.
that's a big issue, a big entity there that needs to be addressed. And I agree with that 100%.
Okay. Home health and hospice workers for obvious reasons. Medical personnel in corrections facilities, jails, and detention centers also for, very obvious reasons. I think the corrections facilities were having big problems as well with the COVID numbers. And then your emergency medical first responders, like your EMTs, paramedics, fire, and law enforcement personnel. So that was like phase 1A. Phase 1B was described as workers and individuals who provide services which have a high risk of exposure due to interactions with the public. So basically, any remaining first responders, that do not have face-to-face contact, but of course they're working around those other persons who do. Workers in jobs that provide critical services such as utility workers, water, trash, transportation, agribusiness and food production workers, those in processing plants, canning facilities, things like that. Persons who live and work in congregate settings, so group homes, homeless shelters, correctional facilities, which I said before, and detention centers, people who are 75 and older, and then people with 2 or more of the following conditions: cancer not in remission, chronic kidney disease, COPD, diabetes, disability, heart disease, HIV, AIDS, obesity, pregnancy, and sickle cell disease. That's all phase 1. That's a very big cross section of people when you think about who all would be impacted. And again, this is just information that's a part of what was provided by the governor on Monday of this week, I guess, as a suggestion for the phases and the rollout of vaccines. Phase 2, I know you're probably in your head saying, well, that's everybody else, but phase 2 is basically your pharmacists, your grocery store, food service and food delivery workers, service industry, postal workers. Then we get into public transit workers. We get into public education, so your K through 12 teachers and staff, childcare workers, school bus drivers, instructors and staff in higher education, people who are age 65 and older, and then again, that list of comorbidities that we talked about, but they've included in this particular phase asthma, cerebral vascular disease, cystic fibrosis, hypertension, immunocompromised conditions, liver disease, and pulmonary fibrosis. So then phase 3 is simply defined as vaccine available to the entire population. And when you take a look at this list, it's like, whoo, it really does kind of take your breath away to see it at first, because essentially, the interpretation is that, well, we're going to get, like you said, first responders, frontline workers, people who are dealing with large crowds and people face to face as a necessary duty every single day, and then everybody is going to get it. But this type of phase in plan, it's not going to happen all at once, right, Dr. Mack? I mean, it's not like it's going to happen in 2 days or 3 days or what have you.
Over time.
Yeah. Over time. Yeah. So, surely there should be, I guess, time to see what the impact could be in certain cases, or the effects, since that seems to be a concern for people. But the bottom line is you have COVID-19 in one hand, you have the vaccine in another, and that seems to be the common sentiment, based on the question that I posted in the network, and even, there's a comment or two here, on this thread. And so you really just have to, I guess, weigh the options. And
Yeah.
Put God before us. Look, and put God before us.
Yeah.
Always.
So let me say this, because you asked me a question and I just did some math. So what happens is if there are 328 million people in the United States, 328 million, 70% will be 230 million.
Okay.
Just to kind of give you an estimate on numbers. So we're talking about 230 million people that need to be vaccinated to get to 70%.
And you were talking about possibly doing less than half of that by February.
Right, by the end of February.
By the end of February, less than the 238 million. I think it was close to 100 million or something like that. By the end of February. Yeah, sometimes when math is quick and sometimes it's not. But yeah, that's considering what we know about people's behaviors, that's heavily ambitious, I think. But you know,
yeah, I think you know, there are a lot of people that are on the fence about whether to get it or not. And, you know, whenever I kind of watch TV and watch them interview people, it's kind of like two trains of thought. Yeah, I'm gonna go ahead and take it. I'm ready for it right now, or I'm gonna just wait and see. I'm thinking I'm gonna get it, but I don't know if I'm gonna be the first. So, and that's what I hear a lot of. Again, I think if there's any questions that you have, that should you should talk to your healthcare provider about it, so they can talk to you about everything that's going on, explain to you about the phases here and what it means. Probably with that phase situation that they've got going out, I probably put asthma and lung people up in phase 1A.
I would think so.
That's about the only thing that I would disagree with what's on there, because COVID tends to be primarily a pulmonary, not only, but primarily a pulmonary condition. So those people I would probably recommend in 1A when I read the breakdown like you just said. But other than that, I think they did a pretty good job with trying to break it down and try to, you know, stratify who should get it first.
From a priority standpoint. One of the comments that was posted on the thread in the network, this particular poster said, for those of us who already have health issues, my concern is side effects. I'm currently taking chemo. I'm definitely concerned about how I will respond to the vaccine. And I know that you said the studies are limited, but is there anything out there, or medical journal wise, that would explain, for example, what the interactions would be or the contraindications if you are a cancer patient, or if you have diabetes, or whatever the case is? Anything out there that people can access?
Not specifically. So let me go back and talk about the first thing with the chemo. That's definitely a conversation that needs to be had with your oncologist. Okay, to understand, you know, what side effects the chemotherapy agent you're taking has and what it could have with a vaccine like this. So I couldn't really answer that question because that would be an individual question to how, you know, which chemo, how many rounds the person's getting, where they are in the rounds, are they having any side effects so far. So that's a good question, but that's an individual question for your oncologist. As far as what was the other part?
Basically, they were just concerned about how the vaccine would respond, or would I guess impact the chemo that they're taking.
Right. That would be an individual thing.
How she would respond to it.
Right, and that would be an individual thing. I wouldn't know, because I don't know if it's so many different chemotherapy agents until I don't know how it would respond to that, or what kind of side effects you would have. That's a good question. I couldn't answer that one.
All right. And then someone else posted, it was a pretty long post, but it was kind of, there were two parts to it. You know, she stated that her greatest fear, of course, is that 6 months down the line, there would be some sort of delayed reaction or side effect. But then at the same time, you know, people take the flu vaccine every single year. And I guess this is based upon what she knows. She says, we know the flu virus changes just about every year, as does the vaccine, but we trust it because the research has been done. The trust has to begin at some point with this vaccine too. I am looking forward to seeing how the next few months goes. So yeah, you know, people are doing a lot of comparisons and have been between COVID and the flu. And I'm sure that this vaccine is going to be different from the flu vaccine. But in the context of what she was saying, I don't know that we have a benchmark or a milestone when we figured that the flu vaccine was trusted by everyone, and I don't think it is trusted by everyone, because everyone, I think people are selective about whether or not they want to take the flu vaccine. At the same time, I think what she's saying has some validity to it, in that we have to think about, okay, well, when will that trust be built up if people aren't willing to move towards getting the vaccine? And it has become run the risk of getting COVID or taking the vaccine type of a balanced way. Let me ask you this important question. I don't know if people really understand what the vaccine is supposed to do. Is the vaccine supposed to protect us from COVID, minimize our likelihood of getting it, but there still could be a chance? How can you describe it as far as what this vaccine is tempered to do?
Both of what you just said. So what happens is, to fight off a virus, you need antibodies. You need antibodies in your body to fight it off. The antibodies are kind of like the army. They're the infantry. They're the infantry. They're there to do the work to protect you. So when you would only have antibodies in your body for two reasons. One, you've been exposed to that virus, or two, you've taken a vaccine to stimulate your immune system to fight off that vaccine. So the antibodies are there as a defense mechanism to help protect you from getting the condition. Now, let me say this. It doesn't mean that you may not get it. Again, that's where the effectiveness comes in. So if you got a vaccine that's 90+% effective, which is pretty good, it's not 100%. So you can get it, but a lot of times if you take the vaccine, the symptoms from the condition usually aren't as bad as as if you hadn't taken the vaccine.
Gotcha.
So it's kind of like having, 100,000 troops protect you. That's the vaccine. Or having no troops protect you. That's not taking the vaccine. Now, again, if you've gotten COVID, your body should have produced antibodies to fight it off, to make it less likely that you would get it again. Again, that's not 100%, because there have been some people that have had rapid decay in antibodies, which I don't think is a lot. I don't think it's the rule. I think it's more of the exception than the rule. But that gets into getting it a second time. Now, we do know that there have been reports of different strains of COVID, just like there are different strains of the influenza. That's why you take the vaccine every year. Again, we don't know if this vaccine is going to be a yearly thing. We don't know if it's going to be an every 2 or 3 year thing or what. Here's how they determine that. You get vaccine A in 2020. Those people that get vaccine A, it should overall reduce the incidence of the condition. If you start seeing those people who got vaccine in 2020 start coming back in 2025 with the condition, then you know that virus probably has only about a 4 to 5 year window, or a 3 to 5 year window. And that's how we determine how often vaccines should be given, when you have what's called waning immunity. We don't know that yet with these vaccines, because it hasn't been studied long enough. So if you get the vaccine in 2020, will you need to get it in 2021? We don't know.
Right.
We don't know. Some vaccines, flu vaccine, are recommended every year. Some vaccines, tetanus, every 10 years. Some vaccines, pneumonia, every 3 to 7 years. So it depends on the expectancy of the vaccine to last for protection.
Okay. Well, Dr. Mack, before we break for the evening, I'm gonna just take a really quick commercial break, and make people aware. That will help to make people aware of the Network Connects, and then we'll come back with your final word for our broadcast today. Okay.
Okay. Thank you.
All right, and we'll be right back.
Thank you.
If you want to support Black-owned and operated businesses in the Grand Strand area and beyond, check out thenetworkconnects.com for a complete list of establishments in our local area. Our network connects Black businesses to community for a wide range of services, products, organizations, and resources that are viable in the African American community. You'll find a wide range of products and services that'll fit your needs, along with information about events and happenings around the local communities. Check out thenetworkconnects.com, connecting Black businesses to community. Thenetworkconnects.com.
All right, Dr. Mack, and we're back, and I'm going to pull up real quick the flyer for the COVID testing, and we'll go over that one more time before we actually bid farewell for the weekend. So here it is. Let me get a bigger view of that. There we go.
Gotcha.
All right. So again, free COVID testing drive through. It's a drive-through testing, and that is happening this Saturday. That's tomorrow, right?
Monday.
No, it's Monday. Monday. It's happening on Monday. Sorry about that. Monday the 21st. From 8 a.m. to 2 p.m. It's going to be at Friendship Missionary Baptist Church, which is located at 1111 Granger Road in Conway, South Carolina. Of course, this is sponsored by none other than Dr. Winston D. McIver Jr. in collaboration with DHEC and MACO. So again, this is your opportunity to get tested before the holidays. And Dr. Mack talked about the turnaround time earlier in the broadcast, and also the fact that this is drive-through testing. So you don't even have to get out of your car to be tested. This event happened as well a couple of weeks ago and was very successful. So you definitely want to know your status going into the holidays, and this is one way to do it. So Dr. Mack, is there anything you want to say about this before we go?
Yeah, please come out. Please pass the word. I've made some connections to be able to try to get as many community tests as I can get. If we don't show up, it's going to be hard to convince these folks to let's do it. Mm-hmm. So again, it not only lets you know your status, but it also lets these people know that we are concerned in the community. And if they know we're concerned in the community, and you've got a physician that's pushing it, then we're likely to make this thing happen. Even if you got tested the last time, come out again. There's some places that are getting tested monthly. Mm-hmm. In my office, my staff, went and got tested, and they're going to get tested again on Monday. And again, you need to know, because you're working with folks, you're around folks, and you don't know what these people may be doing on their off time or their downtime.
That's right.
You don't know who they're around and who they've been around and who they've been around and who they've been around. It's this degrees of separation, and again. COVID doesn't care what your name is. It doesn't care how much money you got in the bank.
It doesn't care about your skin color, all that.
It doesn't care about any of that. And so it's very, very important to take that into consideration, to understand the importance of this, to know your status, to protect yourself, especially going into the holiday.
And I'll even say that, we have some viewers who we can obviously see because they're engaged in the conversation, but viewers who we do not see, who may be even from out of town, take the drive if it's not too far, especially if you don't have any free COVID testing going on in your area. Just come on, and it's drive-through testing. It's quick, it's simple, and you can get on about your day. But don't create an excuse for yourself, especially if it's available. And to the point about the location of it, I think that is so important for what you're doing, Dr. Mack, because it's within walking distance of a lot of residential and apartment communities, especially in that particular area of Conway. So if you can, just make it a really quick drive, and you can get there and make sure your entire family, if need be, is tested. So.
Yeah, and it's been really good. People, it hasn't, and the lines have been long, but it's been moving fast. They're having like 5 and 6 people out there testing, so things are moving. And so please come out, because my plan is to not just do it in the Conway community, but look at other communities as well. But I've got their ear if I can get the numbers there.
You can get the numbers.
Numbers
That's right.
there, then I can get their ear and I can do this in different places. But
Mhm.
again, you know, if you're my Facebook friend, I did put the flyer up on there. April, I think I sent it to you, but if I didn't, I'll make sure I send it to you and you can kind of put it on
I
the
will
side.
be sure to share it everywhere and
Okay.
add it to the
Yeah.
website. And
Yeah.
we'll even make sure we'll get permission and see if we can get it up on Friendship's website as well.
Yeah.
But yeah, definitely spread the word, spread the information. Tim McCray says, I got to drive to Conway, April and Doc. If you feel like you need a COVID test, come on.
Come see us. Come see us. Hey, listen. I know he's claiming Myrtle Beach now, but his roots are down in the big city of Bucksport. So I know.
Okay, all right.
You know that, April?
I did not know that.
Yeah,
maybe I didn't forget. I don't know. But
his roots are in Bucksport, so he's on this side of the waterway with us.
Okay.
Myrtle Beach can't have him all by itself.
Exactly. Well, he's laughing, but Dr. Mack, thank you again so much for this information. It's very helpful and definitely, puts our minds at ease, or at least it gives us more to think about and from a reputable source. And again, I just thank you for being here on Fridays at 4. I want to thank everyone for joining us on the network live. And now, Doc, next week is Christmas, so we won't be here for Christmas, will we?
Probably not.
Yeah, probably not. We weren't here for Thanksgiving,
I'm not sure. I may be with Coastal at a bowl game, so I'm not sure right now. But we'll
exactly.
Shout out to my Coastal Carolina Chanticleers.
Yeah.
We'll be off tomorrow, but the hope is that we'll be up and running for a bowl game. So again, I had to put some things on pause for a little bit, and we'll be fine. We'll be fine. And I just want to give a shout out for one of my buddies from Coastal, former player Lorenzo Talaferro, NFL player, Coastal All-American. That hit me pretty hard this week with his untimely and sudden passing. 29 years old. Such a good, humble young man, and prayers out to his family and his son as well.
Absolutely. Peace and blessings to his family, and may he rest in peace.
Yes.
So as we go into the holiday, again, we just want to thank everyone for supporting us through all of these months, and we'll probably have at least one more broadcast before we go into 2021. Hopefully 2021 will be a little different for us. I'm sure we'll still have COVID-19 updates, but the hope is that everyone will continue to do what they have to do so that 2021 will not be a mirror effect of 2020, and we can enjoy it a little bit more peacefully in the coming year. So everyone, please have a very safe and merry Christmas. Remember, Jesus is the reason for the season, and don't spend too much money, because your bills need money too. So don't go out there, don't create more bills.
That's right.
Be reasonable about everything, because we're still in some very uncertain times. You want to make sure you have a nice little Christmas stocking of some coins set aside just in case some things happen. But again, everyone have a very Merry Christmas, and God bless.
Yes. Thank you.
All right.